I am Dr. Suchandana Dutta Gupta, consultant gynecologist and obstetrician practicing in ILS Hospitals Howrah. Today I'll speak a few lines on ectopic pregnancy. Now, ectopic pregnancy, as the name suggests, is when the pregnancy occurs at abnormal site. Pregnancy does not occur, is not implanted in the uterus, but rather outside the uterus. And the most common place is in the tubes. Although rarely, ectopic pregnancy has also been noticed in the ovaries, which is quite rare. Now, ectopic pregnancy is not so common, but it's a very serious condition for the mother. Because when the pregnancy implants in either of the fallopian tubes, as in the internal reproductive organs, it consists of the ovaries, the two fallopian tubes and the uterus. So when the pregnancy is implanted outside the uterus, either in the fallopian tubes or rarely in the cervix also, which is in the lower portion of the uterus, or rarely in the ovaries, it's called ectopic pregnancy. Now, when it is implanted in the fallopian tubes, pregnancy cannot continue beyond a certain time because the fallopian tubes are quite narrow structures, and as the baby grows, the embryo grows, the tubes dilate, and as they dilate, patient feels the pain. But sooner or later, the tube ruptures. Quite a catastrophic condition and very serious condition for the mother, because as the tube ruptures, there occurs internal bleeding. And the condition is associated with severe pain in the mother. And it usually occurs in the early pregnancy, around 6 to 7 weeks. And the mother complains of sudden increase in the pain in the lower abdomen, either in the right or the left side usually, and associated with vertigo, or she may even collapse due to internal bleeding and low blood pressure. So whenever the mother complains of these things, usually she is rushed to the nearby doctor or the hospital and emergency treatment is required. At times, it may also, this tubal pregnancy may result in tubal abortion, where the pregnancy on its own comes out of the tube and no further, during the ultrasonography or even if operation is started, the tubes are saved. But usual management is urgent ultrasonography when the ectopic pregnancy can be confirmed through ultrasonography and further investigations. And if there is internal bleeding associated with tubal rupture, she needs emergency operation, and often the tube may have to be sacrificed. It has to be removed to save the patient, and further resuscitation measures has to be done. So ectopic pregnancy, really a serious condition for the mother, and it's the cause, if you want to know, it's usually history of any pelvic inflammatory disease, PID in the past, or rarely is associated with intake of some medicine, as it has been found with intake of the emergency contraceptive, I-pill. Rarely is also associated with history of intake of I-pill, and when the I-pill fails, the 72 hours tablet fails, it may result in ectopic pregnancy. So this is all about ectopic pregnancy. Thank you.